Hi, I'm Dr. Ravish, urologist in Aster Hospital in JP Nagar. I'm the lead consultant here. I start this note by saying that Happy November. It's because it's the men's health month of the year. If you see, the men's health actually is the most neglected healthcare in the world. You can see there is a female healthcare, child program, and this. The men's health is the health which has been neglected not only in the government sector and this, even in the family as well. So, I think this month should help us to improve our lifestyle, prevent us from certain disease, and become a very healthy man. It is probably because the men are in most of the situations running the families. If there's a disaster as a man is not well or man is no more alive there, it even kills the family. So please realize mental health is always very important, though it is the most neglected health sector in the world now. Yeah, to say that, as I'm a neurologist, I'm going to just tell you about the urogenital part of the men's health. That means kidney, bladder, ureter, penis, testis, and these things. If you see, this has to be taken care by the men regularly with age. As the age goes on, there is a lot of problem in men's health which is neglected and say it is because of age this is occurring. No, it is not because of that. If you commonly see, prostate is the most common disease in the men after 45 to 50 years of age group. What is prostate? Prostate is a gland which is just present below the bladder, and it is the one which secretes seminal fluid. This enlarges with age. It has two peak eras of enlargement. One is at the younger age group, and next is the age group after 45 years to 55, 60 years. It goes on increasing with age. This is because of the surge of testosterone levels. See, as the prostate grows in size, it causes obstruction in the urinary passage, leading to difficulty in passing urine. There are other reasons which also are there, which is causing difficulty in passing urine. That is the phimosyl skin, that is the skin which is present over the penis, which causes narrowing of the passage, causing difficulty in the meatus, the penile tip, which gets obstructive due to stenosis, causing difficulty in passing urine, stricture urethras, bladder neck, and even stones in the bladder, and even sometimes stones in the kidney and the ureter will cause pain and difficulty in passing urine. So these are the things which we have to take care. What is the most thing we have to see? See, if you see these symptoms, we have to get our regular health checkup done after 40 years to identify what is going on in the system, though you don't have any signs and symptoms, because there are some diseases which will not have symptoms, like prostate, and see a cancer prostate, which is the most commonly present in the males. And see, cancer prostate is the second most common disease in the world, and in Karnataka is the third most common cancer, and it is neglected because in 50 to 60% of the patients there is no symptoms. That means indirectly when the symptoms come, it is already progressed to a level where it is not curable at all. So anything which is identified earlier can be cured by surgical method or by hormonal treatments. And so we should not neglect anything badly. This is why I say men's health is very important, and a man's support in the family is very important. So I think if the health care of the man can be taken care, it is always better. So the main thing I would say, not say about the disease or something about urological or something, I would like to say men's health is very important. Leaving urology, you see the psychological factors the men undergo, financial situations, they go for depression psychologically, and there are the other cancers in the body where stomach and these things are there, and liver, which don't produce any symptoms, but you identify it later in an extensive stage where it is not curable. So please understand, men after 40 to 45 years have to get the regular health checkup done every yearly to monitor things. If you see a lot of saying, why to do when I have no symptoms? If you see any cancers in this, most of them are identified only after it is spread. More than 70% of the patients come in a later stage which is not curable. It is in any study, if you want to see, you can see. So I would like to insist and say, early diagnosis is early curable. So If you monitor your health, the disease are curable. When the diseases are curable, your survival rate is better. That means you are not only surviving better, but you are also keeping your family happy by surviving and also being a support in the family. So men, please, I request you to take care of your health. This is more important for the world and your family also. I would like to end this note by saying Happy Movember's month and also Happy Men's International Day. Thank you.